Listen to this podcast now on the Red Apple Podcast Network.
Why is the middle class shrinking? Why are people facing an affordability crisis while marginalized individuals called informals grow in numbers? Join me as I travel the world, speaking with people living in invisibility, the leaders working to solve it, and uncovering the hard truths shaping our economy and daily reality.
Download all of Red Apple Media's podcasts right now through your favorite podcast platform. The James Golden Show. Entertaining and informative on the Red Apple Podcast Network.
America's doctor, Dr. Peter Michalos, is with us. Good morning. Now, I sent you 3 stories, doctor, that I want to talk about, but I also want to talk about the fact that you have a book coming out. When is it due? What's the title? What's your book about, Dr. Michalos?
Well, the book that I'm co-authoring with Dr. Magdalena Swarczewski is called The Death of Aging. And basically in 1997, when my mother passed away of cancer, I got very interested in how come some people are dying much younger, and then my relatives who were living, for example, back in Greece, were living to be 100. And I got interested in anti-aging and wrote a booklet called Die Young at a Golden Age. And then that now recently, with all the interest in anti-aging, we summarized all the anti-aging literature around the world to basically try to help people not have just longevity, but it's about health span and the things that we can do and the fascinating science behind trying to live longer and healthier. But and to get more information, they can follow it on X. It's at Death of Aging, and hopefully it'll be released by the first week of May. But first of all, before I say anything else, I just want to say what an honor it is to be on your show, because I consider you America's teacher, because you educate people on facts, current events, with compassion, fairness, and really good humor, and, of course, great music all the time. So I just want to, get that out of the way to...
Thank you so much. And let's talk about what people are experiencing, Doctor. And by the way, I can't wait. We're going to do a podcast, you and I, on this book, so that we can talk about it in depth and make that available for people, too, okay? We're going to do that. Yeah, we'll schedule that so that we can talk about anti-aging and the death of aging. Now, let's talk about insurance. Let me give a caveat first. Just give me 1 second, doctor. If you are younger, I understand that most of the time when you start hearing people talk about Medicare, Medicaid, all this stuff, your eyes glaze over. Yeah. Like, here these people these old people talking about, look, you're going to be old sooner than you think you are. And all of a sudden, these things are going to matter to you. They may not now, but they will. That I promise you. So with that disclaimer for the younger members of our audience, just be patient. You'll be there, and you'll understand everything we're talking about sooner than you think.
We have to start by defining them both, because a lot of people don't even know the difference, and I even see politicians constantly confusing the two. So I want to make it very clear. Medicare is a federal insurance program that covers 80% of people's medical expenses for people 65 and up and disabled people, regardless of their income. So it covers hospital and Medicare costs. But they make it sound like it's an entitlement program, but it's actually not. From the day you get your first job when you're 16 years old, and again, referencing to what you just said about the young people, you're paying 2.9% of every paycheck. So let's say your first job, you're making $100,000 a year. You're paying into Medicare $2,900 a year into the Medicare program. So the government has been collecting all this money. And if you make over $200,000 a year, add an extra 0.9% to that. And if you're self-employed, you pay that 2.9% yourself. So you've been paying into Medicare, but they try to make it sound like, oh no, we're just taking it out of taxes. No, we've been paying in it since our first job. So that's number one. And there's Part A, which is the hospital part, which In addition, we have to pay from, for example, our Social Security check, another $200 a month. Then you have to pay for Part B, which can be another $200 plus a month. And then there's also a prescription portion, Part D, which is another $100 a month. So for the average person, you're paying $5,000 a year, and a couple is paying about $10,000 a year just to be on Medicare, and versus Medicaid, which is basically a joint federal-state program for low-income individuals with little or no costs out of pocket to individuals, and that's based on income. And that also covers like long-term care insurance, which the rest of us don't have with regular Medicare. It even covers vision and dental. So the problems are they came up with something back in 2003, and they call it Medicare Advantage Plan. So traditional Medicare is not-for-profit. You're dealing directly with the government. These Advantage Plans, or what I sometimes refer to and others refer to as disadvantage plans, are as the insurance companies, they contract with Medicare for a fixed amount of money. And the only way you can make a profit is that you have to limit or deny or restrict care. And the issues are that many doctors and hospitals don't take it. There's limited doctor networks and hospitals that are in it, and they restrict which hospitals you can go to. And you also require pre-authorization that delays care, so you have to get a pre-authorization to get a CAT scan or an MRI, and there's a lot of unexpected out-of-pocket expenses and deductible that they don't tell you about. Just for an example, the Premier Cancer Center, for example, in the New York area, Memorial Sloan Kettering, they don't take the majority of Medicare Advantage plans. And then you have all the snowbirds, for example, in Florida who sign up for these Medicare Advantage plans, and then they come to New York and they get sick, or they go to another state, or seniors who travel a lot, and most doctors and many hospitals won't accept these Medicare Advantage plans. So that's the first problem, is defining it and understanding, what the differences are. And, prior authorization in an office, if they deny an MRI, a CAT scan, and for the office, which people don't realize, doctors' offices only make about 20 cents on every dollar after they pay all their staff, malpractice insurance. So it's basically, when you have to do these pre-authorizations, the doctor has to pay somebody to do all that. They can be on the phone for an hour with the insurance company, and that's a form of what I call theft of services. And there's multiple layers of uncompensated administrative burdens for doctors' offices, and you have to spend staff hours and money to pay for all these things to happen. That's why doctors hate Medicare Advantage, because they pay less and less every year. So that's the premise of what happens. And in reference to the articles that you spoke about, basically, there's 60 million people on Medicare in the United States, and all of a sudden, in certain communities, all of a sudden this past year, a lot of insurance companies, if they decide that they look at their numbers and they're not making profits, they drop 3 million people. And I'm 65 and I have a Medicare prescription plan. I was one of the people dropped too on my Medicare prescription plan, and I had to go and start searching for another plan.
You're a doctor, and they even dropping the doctors. It's amazing.
It doesn't matter. Whoever you are, you can get dropped. And then you have all these rules. Once you sign up for one of these Medicare Advantage plans, they lock you in. You can't even get out of it. There's only certain windows you have. The window you have to get out of it and opt out and go back to traditional Medicare is like January 1st to April 1st. And then our usual period to sign up for regular Medicare is October
November.
October 15th to December 7th is the usual time. So you have to really stay on top of this. So in addition to the fact that you've been paying for this since your first job into the system, plus you have to pay another $5,000 a month, and then you have to deal with these other issues.
A year.
So it's better.
$5,000 a year.
Right. It's better to stay in a regular, traditional Medicare where you deal directly with the government. Again, it's not an entitlement. You paid into it all these years. So you don't have someone else rationing your care, because that's the only way you make a profit. And the other article you sent me, where, for example, Kaiser, which is supposedly not for profit, made a $9 billion profit, but they got into trouble with the government, and they had to pay out a large amounts of money because they were, restricting and limiting access to care, and that they were also upcoding, which basically means they had all these additional diagnoses to make the condition, for example, look worse so they can collect more. But meanwhile, they get about $1 billion a year in subsidies by calling themselves a 501c3 not-for-profit, and they don't pay real estate tax, and they don't pay federal tax on their income. So that's another thing. But meanwhile, the CEO, for example, of that company made $13 million last year, and their executives made collectively $200 million a year. So the problem is that
hold on, because we're rushing through that in a minute. I just want to just really people understand this. Kaiser Permanente sets themselves up as some good guys. Oh, we're not for profit. Oh, we're not about profits here. They raked in $9 billion because they say they're not for profit, and because that's the way that they're registered with the government. They're not paying taxes. They're regarded as a charity. Yet you have the executives here, as you just recounted, clocking in over 200 some odd million dollars salaries for a charity. Then they're involved in practices that some people consider to be questionable, and the government has considered questionable as well. They've had to pay fines. They say, well, the stuff we got caught, we wanted to avoid the cost of litigation. When is this scam going to be burst? And why is this scam on Americans, and they deny coverage to people? How is this scam allowed to continue?
Well, there's a big issue with not-for-profits, and basically the way people do it is that they just have not-for-profits. Even some of these organizations for veterans, if you looked at the salaries and the way they make their profit is they basically hire their friends, their relatives, and they give them these major amounts of salaries. So they call it not-for-profit, but they're profiting in other ways, through even, the wining, dining, the travel, the hotels, and they get paid in other ways. But again, this is not just our opinion. This was, Scott Lambert, the acting deputy inspector general, said that they were inflating diagnosing codes to boost profit, Kaiser, and they ended up having to pay $556 million just to settle that claim. So that's part of the problem. But, we need to have solutions, for example, in healthcare system. We need lawsuit reform, tort reform, because it's affecting access to care. Many communities don't have a neurosurgeon because it's $290,000 a year for insurance. So we need to have access to care, which is very important. And again, things like Medicare Advantage, if doctors aren't accepting it, and a lot of hospitals, so if I have cancer and I need a certain chemotherapy and they're not going to pay for it, what use is it to me? But people don't do their homework. Unfortunately, we get bombarded with commercials. One of them features a famous football player, quarterback. I don't want to mention any names, and they're telling you how great it is. The problem is once they lock you in, they make a profit by saying, no, you can't have this MRI. And I can't tell you how many cases I know of, for example, someone with severe headaches, and they were trying to deny the MRI. This person ended up having a brain tumor that was missed, or a subdural hematoma, a bleed in the brain. So a lot of them, by denying care, they're actually practicing medicine without a license. And the other problem with the Kaiser issue is that they're both the insurer and the provider. So there's a conflict of interest, and they've pitted hospitals and doctors against each other because the hospitals are trying to get the most of that healthcare dollar percentage, and then they they're trying to take it away from the doctors, and the doctors obviously want more. And that's why all these hospitals have grouped together and formed these large networks. So now, for example, in New York, 3 or 4 hospitals come together, then they go to the insurance company and say, well, we represent 1 million people, so you have to give us a better rate. So there's this whole behind-the-scenes war going on capturing some of those healthcare dollars. But in the end, the patients are the ones who suffer by restricting access to care, limiting access to care. But, there are solutions that, we can talk about as well to try to improve things.
Okay, here's what I want to do, because I don't have time to do solutions right now. I don't know what your schedule is like next week. We laid out problems this week. Can you come back next week in the same time and let's talk about solutions?
Absolutely, because I want to be on the James Golden Show because you give people real actionable data and solutions to help improve their quality of life. And I'm grateful to be able to explain to people so they can understand, the terminology and what the difference between Medicare and Medicaid is. And again, I thank you very, very much for what you do.
Thank you. And so next week, folks, make a date. Next week, we're going to talk about solutions to some of these issues because this is important. You know what? And I'm going to just say in advance, and I don't know whether you will agree with me. If we are finally able to really solve the healthcare problem in the United States, our economy would take off even further than it is now. It would take off like a rocket in just this area alone if some of these problems are really solved and people get the care that they need.
Yeah, absolutely. We have to move from the sick care model to the prevention model because if people are healthier, they won't be using as much health care.
Love it.
The James Golden Show on the Red Apple Podcast Network.
Sacco and Felix, New York and New Jersey's premier attorneys at law. Their team brings decades of experience across a wide range of practice areas. Whatever life brings, they're your legal team. From everyday matters to complex cases, they've got you covered. With the experience you need and the results you want. Because when life gets complicated, they make it simple. SaccoFilas.com. SACCOFILLAS.com. 2 C's, 2 L's.